Hello, this is Dr. Grande. Today's question is related to bipolar disorder, and specifically it's asking about rapid cycling, which is a course specifier for bipolar I disorder and bipolar II disorder. And the question is, what is rapid cycling? So rapid cycling is a course specifier, as I mentioned. It's not a subtype. So course specifier gives us more information about the presentation of a disorder. So with rapid cycling, that's the technical course specifier, lets us know that the presentation of bipolar I disorder or bipolar II disorder has a special characteristic we don't always see. In this case, 4 or more episodes of either depression or mania in a 12-month period. Usually with bipolar disorder, we would not see that number of episodes. So typically with bipolar disorder, in a year, we would expect to see maybe 1 or 2 episodes, usually not 4 or more. But there are other rules associated with the with rapid cycling course specifier. So the episodes, again, can be depression or mania and any combination. So it could be depression, mania. It could be all depression. But there are certain rules, as I mentioned. The episodes, whether they're depression or mania, have to meet the full criteria. So they have to be officially an episode according to the DSM. Also, there are rules for how they're separated. So if polarity changes, meaning if somebody goes from a depressive episode to a manic episode, or from a manic episode to a depressive episode, then that counts as a distinct episode. If it's the same episode twice, meaning mania and then mania, or depression and then depression, it has to be separated by at least 2 months, and during that time, the individual needs to be in partial remission or full remission. If the episode is not separated by 2 months, it does not count as 2 distinct episodes. That's just 1 episode. So again, with rapid cycling, 4 or more episodes in 12 months. Now, there are some other characteristics associated with rapid cycling, information we know from research. Rapid cycling is more often associated with females as opposed to without rapid cycling. It tends to affect individuals who are younger, and it's more likely to have an onset of less than 17 years old than without rapid cycling. Also, rapid cycling is associated with higher morbidity, specifically more frequent suicide attempts and more hospitalization for mental health reasons. We also see some characteristics of the depression and mania that are a little different, usually with rapid cycling as opposed to without it. For example, with individuals who have rapid cycling, usually we think of the mania as being less severe and the depression as being more severe, and we're less likely to observe psychotic symptoms in individuals with rapid cycling. Another characteristic of rapid cycling, and I covered this a little bit in talking about the different severities with mania and depression, is that the cycle is oftentimes a long period of depression and a short period of mania. Now, with bipolar disorder without rapid cycling, you can still have that same pattern, but of course you wouldn't see 4 or more episodes in a year. And usually when we think of bipolar disorder, we think of alternating episodes. Usually we think of a manic episode occurring, and that's followed immediately by a depressive episode, although it certainly isn't always that way. Somebody can have a manic episode and then a period where there's no symptoms and another manic episode. The same thing can happen with depression. Also, there could be a depressive episode followed by mania. And again, that's what we see with rapid cycling, except, as I mentioned, the depressive episodes are usually long and the manic episodes are usually shorter. Now, with rapid cycling is officially the course specifier, as I mentioned, but there have been other rapid cycling specifiers that have been suggested. They're not official, they're not part of the DSM, they're not official in that sense anyway, but they are used in practice sometimes, and they are substantially more controversial than rapid cycling. It's my opinion that most clinicians look at the with rapid cycling course specifier and generally agree with how it's represented in the DSM, meaning what happens in real life tends to match the description of the DSM of rapid cycling. More rapid cycling is not always agreed upon. There's more disagreement with the idea that we could see extreme cycling. So the other types of cycling that have been mentioned, one of them is ultra rapid cycling. So this would be, instead of looking at months, like 4 times in 12 months, this looks at rapid cycling that occurs within weeks or even in several days. Usually, however, ultra rapid cycling is defined as more than one episode in a 1-month period. Now there's another level that's even more rapid cycling than ultra rapid cycling. This has a couple names. One is Ultradian rapid cycling, and another is ultra rapid cycling. I usually use the term Ultradian. And Ultradian refers to rapid cycling that occurs within a day. So within a 24-hour period, you would see both mania and depression. Now, as I mentioned, this is a bit controversial. There are 2 schools of thought here with ultra rapid cycling and Ultradian rapid cycling. One is that those 2 constructs are real, that rapid cycling can occur that quickly. And there are a number of individuals who believe that's true. Another theory is that what we're seeing when we believe we're seeing ultra rapid cycling or Ultradian rapid cycling is actually the mood lability, meaning the unstable emotions that's often associated with bipolar disorder. Meaning we're really not seeing something distinct, we're really not seeing a version of rapid cycling, but rather just unstable mood. So it's not really clear if ultra rapid cycling or Ultradian rapid cycling actually exist, but it is an interesting theory, and there certainly are some presentations that seem to support that theory, and other presentations that seem to support the mood lability theory. Again, however, in the DSM, the only official course specifier related to rapid cycling is the with rapid cycling specifier, and that's 4 more times in a 12-month period. Another important point about the concept of rapid cycling is that it's a course specifier, as I mentioned, so it can be present or not, and that can change. So there can be an individual with Bipolar I disorder or Bipolar II disorder that has that diagnosis with rapid cycling, that course specifier added on, during a few years, and then after that, they might not qualify for that course specifier. So if somebody has rapid cycling, they won't always necessarily have rapid cycling, and if they don't have it, they might have it later on. So it's not necessarily permanent. We usually think of bipolar disorder as a condition that stays around a long time, unfortunately. But the rapid cycling specifier doesn't necessarily stay around. I hope you found this description of rapid cycling to be interesting. Thanks for watching.